Yes, good evening all. Hi, hello everyone. Good evening. Yes, am I audible and visible? Audio is clear? Yes, guys. Yes, guys. Okay. Dr. Sinch, Umme Sania, Dhananjay M, Sachin Agrawal, Yogita, Nafisa, Arya, Aishwarya Baligar. Good evening all. So welcome to Farre Series. The most commonly asked university question, the long essay, short essay in upcoming November exam. So today we're discussing asphyxial death. Yes, Priyanka, cartoon, lion. Good evening all. Yes, so let's start. So today we're discussing the most expected long essay and short essay in asphyxial death. So in the beginning, we will have discussion about the pattern of exam, distribution of topics in forensic medicine and toxicology. Later, asphyxial death. Then we'll have a discussion of spotters in toxicology, around 10 spotters. Okay, so that we will make it interactive. Yes, Sarbajit. Okay, good. So let's start now. Yes, study buddy, all. Okay, let's start now. Distribution of marks in suggested blueprint, that is question paper of university exam. Forensic medicine. As you know, one paper, 100 mark, one paper. It is divided into general forensic medicine. General forensic medicine. What is general forensic medicine? That is dying declaration. Very important. So, what is dying declaration? What are differences between dying declaration, dying deposition? 3 marks question. Then medical records. Medical records. Cause of death, that is MCCD. Very important university practical exercise. Then comes his forensic pathology. So as you know, forensic medicine broadly divided into forensic pathology and clinical forensic medicine. So in forensic pathology, usually the postmortem examination. Yes, that is basically thanatology. Thanatos is a Greek god of death. The study of death in detail known as thanatology. So that is commonly asked. Then asphyxia, thermal death, all this basically comes under forensic pathology, 25 mark. 25. General forensic medicine, 5. Then clinical forensic medicine. So basically the injuries, mechanical injuries, identification, firearm injuries, very important. Sexual offenses, definition of rape. Okay, and what are the descriptions of rape, types of rape, victim examination, accused examination, cause of death. So very commonly asked. So then comes is, that is around 25 marks. Clinical, very important, 25. Forensic pathology, 25. Then medical jurisprudence. Juris means law, prudence means knowledge. So application of legal knowledge in clinical practice known as medical jurisprudence, that is around 15 mark. So basically euthanasia, ethics, principles of ethics, medical negligence, civil negligence, criminal negligence, very commonly asked. Then forensic psychiatry, delusion, hallucinations, true insanity, feigned insanity, commonly asked, 5 mark. Then lastly, general toxicology or basically toxicology, 25. Okay, so this is how your forensic medicine paper is divided in most of the universities. It is given by NMC as per CBME curriculum. Yes, okay, Sutapa, Sumanta, Swati. Yes, so Iqbal, Ashutosh, Sarabjit. Good evening all. Good evening. Now I have a question for you. So that is basically this question. This is very commonly asked long essay. Long essay 10 mark. Sometime it can be 5 mark question. Define hanging. Define hanging. Asphyxia triad. Types of hanging. Cause of death. Postmortem finding. And medico-legal importance. Very frequently asked 10 marks question. It is divided like this. 1 plus 1 plus 1, 5 plus 2, like that. Depends on the university actually. But hanging is very commonly asked from the asphyxia. Not only hanging, strangulation, suffocation, drowning, frequently asked. Yes. Now let's see what to write if this question asked. So definition. You need to write about the definition. What is the definition of hanging? Frequently asked viva question also. So hanging is defined as it is a type of asphyxial death caused by suspension of the body by a ligature material, encircling neck, the constricting force being weight of the body or weight of the head. So this is what you need to write in the exam. Let's elaborate some more points, because so as a distinction student, as a topper of the batch, you must write some more points like this. Hanging is a form of asphyxia. Can anyone tell me what is the literal meaning of asphyxia? What is the literal meaning of asphyxia? Yes, come on, try. Let's make it interactive, all of you. Hello? Can anyone answer? Hi everyone. Yes, lion, very good. So asphyxia means pulselessness. Pulselessness. Literal meaning. It is word by word meaning. But in general, it is a combination of hypoxia and hypercapnia. That's okay. That's one point, entrance point. Then comes the suspension. Remember, suspension is there only in the hanging, not in the strangulation. So, like example here, look at this. We have one friend here. His name is Brownie. Okay, he will come again and again in our class. So, example here, Brownie. So, in case of hanging, there will be suspension like this. Suspension. But in case of strangulation, there is no suspension. This is one very important point. Now, can anyone tell me what is this method of asphyxia? Look at this now. Say hi to my Brownie. What is this method of asphyxia? Come on, guys. What is this method of asphyxia? Can anyone answer? This method, say single hand, and this method of asphyxia. Method of homicide, we call it as. What is this known as? Is it hanging? Hanging, or is it strangulation, throttling, working? What is that? Yes, very good. Lion, Yogita, Ashutosh, excellent answer. Excellent. So your answer is right. Now one more. What is this method known as? See, look at this. Constriction of neck at the elbow bend like this. What is this known as? Dekhe batao, jaldi batao. What is this method known as? Constriction of neck at the elbow bend or the knee bend. What it is known as? Chalo. Ha, very good, Dhananjay. This method is known as Working? No, it is known as basically mugging. Mugging. So mugging can be 3 marks question. Working can be 3 marks question. Okay. Yes. So this is what you need to memorize. Okay. So suspension is there. Suspension is there only in case of hanging, not in the case of strangulation in general. Okay. Yes. Now, constriction of force being weight of the body. Weight of the body in complete hanging. Weight of the head in case of incomplete hanging, we call it as partial hanging. So there are 4 important MCQs. I'll repeat again. Asphyxia means pulselessness. Suspension of body is present. Weight of the body in complete hanging. Weight of the head in case of incomplete hanging or partial hanging. So 4 important MCQ. Now one more very important MCQ. What are the important features of asphyxia? So important features are CPC. CPC mnemonic. So all of you write A is equal to CPC in the chat box. A is equal to CPC. Keep writing. So A for asphyxia, C for cyanosis. You can see here, cyanosis is a feature of any asphyxial death, not only hanging. P for petechial hemorrhages, small hemorrhages. They are known as Taudeau spots. They are non-specific. Then T for congestion. So congestion of organs is a feature of any case of asphyxia. You take mugging, hanging, strangulation, drowning. One common feature is congestion. Okay, everywhere congestion. Chalo. Next. So next we have, okay, this is what you need to write. So you will get 2 marks if you write this. Then types of hanging. Now here, there is an image here. You can see here, based on the suspension, there are 2 types of hanging, A and B. Can anyone identify? In picture A, total body is suspended. The weight of the body acts as a constricting force. In picture B, part of the body touching the ground. So can be sitting position, standing position, kneeling position, supine position, but body part touching the ground. ये क्या होता है बताओ, जल्दी बताओ A क्या है, B क्या है? So A must be complete hanging, and B matlab that is basically partial hanging. Okay, good. Dhananjay, yes, good. Now here one more important question. So what is the weight required to occlude jugular veins? So we have jugular veins, we have carotid arteries, we have basilar artery, and we have trachea. So what is the pressure required to occlude jugular veins? That is around 2 to 3 kg. Carotid arteries, 5 to 6 kg. Trachea, around 10 to 12 kg. Then comes is your vertebral artery, VA, vertebral artery, that is around 20 kg. So this is very important MCQ. So this can be asked in INA-CET, can be asked in NEET PG and university exam also. As you know, university exam there will be 10 MCQs or 20 MCQs as you know. Okay, good. Dhananjay, great. Dhananjay is answering, that's great, really nice. Chalo. Next we have one more classification based on the position of knot. Now look at this A. The knot is there at the nape of the neck. B present at the chin. And C, it is present somewhere just below the right mastad or left mastad. What are these types? Yes, try. Dhananjay, Sarvajit. Try. Sutapa, Samantha. Sutapa, come on. So this is basically typical hanging. This is judicial hanging. And this is atypical. Simple it is, simple. Then based on the intent, it is classified into suicidal, pasi, suicide, homicidal, murder, khuni, murder, accidental, accident, and ho sakta hai, judicial also. So there are basically 4 types. So suicidal is the most common one. Why? Because death occurs within 3 to 5 minutes. So people say 3 to 5 minutes, but in my experience, I have seen unconscious occurs within 30 seconds. The person dies within 1 minute. So one of the very common method used. So yes, that is about the intent. Homicidal, known as lynching. The first explained by William Lynch, American captain. That's why lynching. Accidental. Priyanka, Dhananjay, can you give an example for accidental hanging? Very interesting. Accidental hanging. Like example, naked dead body in a closed room, involved in some masturbation or some sexual perversion. Room is locked from the inside. No suicidal thought, nothing is there. But in a crime scene, total body is naked. There is a oblique ligature mark, a transverse ligature mark, seminal stain. So what is that accidental death of hanging known as? Yes, very good. Sutapa is telling sir masochism. वो masochism नहीं है. तो masochism ठीक है. फिर भी there is a name given to that. Cinch. What is the name given to that? There is one name given to that type of accidental hanging in case of masochism or fetichism. What is that? So lynching is homicidal hanging. Homicidal hanging. Accidental basically known as, that is autoerotic hanging. Or accidental hanging can happen, so even in children's, so while playing it can happen, right? Then judicial, that is judicial method of death in India. There is a fracture of C2C3. C2C3 fracture. Okay, all of you write in the chat box. Judicial is equal to C2C3 fracture. Write this in chat box. Everyone please write. So you can write 1 time writing is equal to 10 time reading. So you can keep yourself awake and you can keep myself awake in the class. Yes, right, keep writing. Keep writing, guys. Good, great. Aishwarya, very good. Chalo. Next we have cause of death. So simple it is. Cause of death can be asphyxia. So when trachea occluded, there can be asphyxia, hypoxia, hypercapnia. Venous congestion. When jugular veins occluded, there can be venous congestion. Sometimes the question can be asked, what is the commonest cause of death? Asphyxia and venous congestion. Simple. Then dislocation of cervical vertebra in judicial hanging. Reflex vagal inhibition when there is a fear. Sometimes what happens? So while hanging, maybe lynching or any type of hanging, so there can be fear. The fear can stimulate the vagus nerve, then it can lead to reflex vagal inhibition and death. Then cerebral anemia, when vertebral arteries are occluded, there can be cerebral anemia. The fatal period 3 to 5 minutes. 3 to 5 minutes. Yes, chalo, good. Yes, this you will get, PDF you will get after the class. So don't worry, I'll provide you. Chalo, next. Next comes is the postmortem finding. Postmortem, that means autopsy finding. So in exam you need to write external finding, internal finding. You need to write point-wise manner, not the paragraph manner, point-wise manner. So let's start with the face. So face, what are the features? So can anyone tell me, in case of hanging, you must have seen in movies, you must have seen in Instagram and all. What are the findings in the face? आपको face में क्या क्या finding मिलता है बताओ, जल्दी बताओ, है ना? Pale होता है, pale. अच्छा, very good. So it can be either congested or it can be pale. So some books gives it is completely pale in case of complete hanging and it is congested in partial hanging. So usually we say it is pale. So pale or it is congested. Again, depends on the case. So there can be cyanosis, There can be pedicle hemorrhages. PH is pedicle hemorrhages. Protrusion of tongue. Okay. Then the very important is dribbling of saliva. Dribbling of saliva. Okay. So YouTube will not allow the autopsy pictures. That's why this picture is there in the slide. Okay. So basically, this is just to explain dribbling of saliva. Dribbling of saliva, when it is present, it is ante-mortem hanging. That means the person was alive at the time of death, or at the time of hanging. Basically, at the time of hanging, he was alive. So that is dribbling of saliva. Then in some cases, you will get lay face is sympathetic. Okay. Lay face is sympathetic. Lay face is sympathetic. Any other finding other than this? Other than this face? So we are discussing only the face finding. I said congested or pale, cyanosis, tongue protruded, dribbling of saliva, pedicle hemorrhages, and lay face sympathetic. Any other? So neck is elongated. Neck is elongated. Sometime there can be turning of the neck towards the side opposite to the knot, like this, not like this. Okay. So there can be okay. Ipsilateral opening, that's okay, that's fine, that's okay, that's great. So all these are basically face finding. So now neck finding. So what are the findings in the neck? So neck, so there will be ligature mark. Ligature mark. Again, oblique ligature mark in case of complete hanging. Transverse ligature mark in case of partial hanging. So normally we say oblique ligature mark in hanging, transverse in strangulation. But remember, transverse ligature mark can be seen in partial hanging. So neck ligature mark is a type of pressure operation. Cardio spots, basically pedicle hemorrhages, small pinhead sized pedicle hemorrhages over the face, conjunctiva. So they are known as tardive spots. They are non-specific. They can be seen in scurvy, thrombocytopenia, and other conditions. Yes. Then postmortem staining. So postmortem staining normally in the lower limbs. So when body is suspended for some time, maybe 5 hours, 6 hours, or the entire night. So there is postmortem staining at the lower part of the lower limb and the lower part of the upper limb, sometime in the upper limb. So we call it as glow and stalking postmortem hypostasis. Then sphincter relaxation. So that can lead to urination. Defecation, there can be defecation. There can be a seminal discharge as well. So all these are basically external findings. Okay. So is it clear? Arlene, Hemant, is it clear, guys? If you have any doubt, you can ask me. Now look at this finding. So this is a case of hanging. You can see here knot is there. Knot. The knot compresses cervical sympathetic chain. Eye on the same side remain open. The pupil is more dilated. On the opposite side, closed eye. So what is this finding? Is known as okay. Lay face is sympathetic. Very good. So lay faces, basically lay faces. Why? Because of compression of cervical sympathetic chain. Cervical sympathetic chain, CSC. Normally on the same side of knot. Same side of knot. Remember, dribbling of saliva, opposite to side of knot. This is on the same side of knot. Yes, chalo. Good. Now comes is your one more finding. Look at this finding now. In a case of hanging, especially over the eyelids and conjunctiva. So 0.1 to 2 millimeter, up to 2 millimeter. So there are pinhead size hemorrhages what are these known as? So these are known as tardive spots. Tardive spots because of venous congestion. So because of venous congestion. Tardive spots. Good. Janit, Priyanka. That's great. Tardive spot. Arya. Then there's one more finding. Look at this. There is a collection of blood after death in the dependent area, in the lower part of the lower limb, upper part of the lower limb, glow and stalking postmortem hypostasis. But here there is no color change on pressure. So what is the inference? So no color change on compression. So when you compress, when you press this area like this, there is no color change. So my question is, what is the importance of that? What is the importance of that, Hemant? Hemant. Fixation, very good. So this is basically fixation. That means time since death is more than 6 hours. TSD more than 6 hours. So this is about the external finding. Okay. Now let's see about the internal finding. So what are internal findings? So this is how you should write in the exam, guys. External finding, internal finding, medico-legal importance, definition, some diagrams. Okay, you will get distinction in forensic medicine. Who knows? You might get gold medal also. So, okay, so be attentive and you try to get good mark in forensic medicine. Forensic medicine is very interesting and very scoring subject as well. Okay, chalo. Okay, that's great. Now, internal finding, remember internal finding, the neck is opened at last. So, neck is opened at last. And so, what is the incision that is used? Modified Y or Y-shaped incision. Some books gives modified Y incision or Y incision. Then the dissection known as bloodless dissection of neck. Okay, then the question can be asked in Viva. How to remove the knot? How to remove knot when it is there along with the dead body? Okay, so example, this is the ligature. So this is ligature. Consider this is a knot. So knot is there like this. So my question is, how to remove knot in case of, or what is the procedure to remove the knot or the ligature material in case of hanging? Yes, Prakar is telling, sir, cut the ligature opposite to knot. Excellent. For example, this is the knot. You need to cut opposite to knot, and cut end should be tied. Okay. So this is the way you must do while removing ligature material. Good. Great answer. So the answer given by Priyanka, yes. So Priyanka. So good, Priyanka. So be attentive, try to answer. Then, so what are the internal findings? When you see subcutaneous tissue, so there will be dry hard parchmentization. Dry hard parchment paper appearance. It looks dry, it looks hard, it looks like a parchment paper. No congestion, no petechial hemorrhages, no hemorrhages. But in strangulation, it will be soft, it will be reddish, and there will be a lot of hemorrhages. This is again very commonly asked. So, dry, hard and parchment appearance. Write this in chat box. SC is equal to Dry, hard, parchment appearance. Dry, hard, parchment appearance. Keep writing, guys, keep writing. Then hyoid bone. So hyoid bone fracture very common after the age of 40. The common type of fracture is outward compression fracture. Outward compression fracture. Inward compression fracture, that is seen in case of throttling. Outward compression fracture seen in hanging. Carotid artery, so there can be tear in the carotid artery, that is known as Ams's sign. For example, this is the carotid artery. Carotid artery. So there can be transverse tear like this. So there can be transverse tear like this. So this is known as Ams's sign. So vertebra, there can be hemorrhages, that is known as Simon's sign. There can be hemorrhage, bleeding, that is known as Simon's sign. Again, non-specific. It can be seen in road traffic accident, so it can be seen in other conditions as well. Lungs, they're basically congested. Brain and other viscera, congested. So why congested? Viva question. Venous congestion. When jugular veins, carotid arteries are occluded, there will be congestion. So all these are important features. Okay, that's fine. Sure. Now look at this. Look at this now. One more important 3 marks question. What are types of hyoid bone fracture? So one is inward compression fracture. The second one is outward compression fracture. You can see here inward and outward. So this is outward compression fracture because the periosteum is damaged from inside in hanging. Periosteum is damaged from the outside in case of throttling. So when periosteum is damaged, there will be inward compression. Okay. So what are the parts of hyoid bone? Body, lesser carnum, greater carnum. What is the common site of hyoid bone fracture? This is the common site at the junction of inner 2/3 and outer 1/3. Inner 2/3 and outer 1/3. So what are the types of hyoid bone fracture? 3 marks question. So one is abduction fracture. Abduction fracture, that is basically outward compression fracture. The second one is adduction fracture, that is basically throttling. Then, so basically 2 types. So one more is there because of the traction. So that is the fracture due to traction. Okay. The third one is fractional fracture. Fractional fracture because of the force which is acting on the hyoid bone. So 3 marks question, very commonly asked. And hyoid bone fracture very common after the age of 40 years. So all of you write in the chat box. Avulsion, yes, that is basically known as avulsion fracture. Avulsion fracture. Good. So all of you write in the chat box. Hyoid bone is equal to abduction, adduction, avulsion. Abduction, adduction, and avulsion. Keep writing. 3 marks question. Come on, guys. Come on, try. Try. So now here is, I am showing you some more. Now look at this. Again, we have brownie here. Brownie. Huh? So brownie is my friend. Okay. This is just for a demonstration. So don't take it seriously. I'm not committing any crime. Okay. So look at this. So brownie is here. I'm very angry on brownie now. Now what I will do now? See? Throttling. So my question is, what type of fracture is common? What type of fracture is common? चलो जल्दी बताओ, जल्दी बताओ, ध्यान से सुनो, ध्यान से देखो एंड रिप्ले. ये देखो क्या है. Remember, I'm using only one hand, so there can be 6 penny bruise. There can be vasovagal inhibition and death. When I use both the hands like this, both the hands, then 6 penny bruise looks different. Okay, so this is one importance of 6 penny bruise. That is in case of throttling. Yes, basically adduction fracture. It is not abduction, beta. Adduction fracture. Inward matlab adduction. Outward matlab abduction. Okay, getting my point? Yes, good. Good, guys. So guys, all of you just say hi to my brownie. So he's tired now. He's tired of all these demonstration. Just say hi, hi, brownie and all. You just make it interactive. Come on, guys. Okay. Ashutosh, good. Hi, hi, brownie. So our brownie and Pinky will come again and again in upcoming classes. So okay, we have one more Pinky also. So brownie in asphyxia, Pinky in sexual offenses class. Okay, we have Pinky also. So now look at this. Pinky is also waiting for you for tomorrow's class. Pinky is there. So tomorrow she will participate. Okay. So now don't worry. Now time being. Okay. Medico-legal importance I discussed already. Already over. This completes our hanging. So hanging is over. All of you guys understood hanging? Definition लिखना पड़ेगा आपको. इसके बाद क्या लिखना है? Types, typical, atypical, है ना? Judicial, then partial, complete, suicidal, homicidal, lynching and all. Then cause of death 1, 2, 3, 4, 5, 6. External finding, internal finding. That's all. So I think if you write all these points out of 10, probably how much is the examiner going to give you? You just tell me by your experience. If you write all these things, all the points which I discussed in the class, out of 10, what must be your expectation? Just say Priyanka, Dhananjay. Yes, around 7. 7 to pakka. 7, 8 to pakka. Okay, that's great. 10, okay, some are telling 10, that is okay. That's fine. 8 you will get. Time problem is the lion. Okay, that's okay. Now I have an interesting question for you. This is asked in RGHS. So University of Karnataka, university question. So there are other questions also. Look at this question, short essay basically, 5 marks question. A 18-year-old male was found hanging. Hanging, not given, partial hanging, complete hanging, probably partial hanging. Then a leather belt attached to a grill of the window. Window. Mirror was found. There was a mirror in front, like this mirror. The mirror was there. Mirror. Then reflecting him in full height. Full height. So everything is reflecting properly. Then he was dressed in a woman's clothing. Oh, he's a male basically, dressed like a female. So he's suffering from sexual perversion. That is known as transvestism. So transvestism. Transvestism is equal to eonism. Eonism is equal to cross-dressing. Cross-dressing. So, and it is showing some magazine there, some dirty material there, magazine and dirty material. Then over the floor, basically over the floor. So what is the name given to above clinical condition? And what are the medico-legal importance and the postmortem finding in this condition? So it's basically hanging. So you can write about hanging in detail. Hanging in detail. Internal, external finding, same only. But the diagnosis is important. So what is this basically? What is this? Chalo, chalo, Arya Toprani. What is this condition? So for better understanding, Now look at this. This is the question asked. Male with a belt around his neck and he is doing something there. Anna, what is this basically? Chalo guys, come on. This is already we discussed in the class. Accidental hanging. So what happens? So this is basically autoerotic hanging. Okay, good. So that's okay. That's you understood. That's great. Then comes his drowning. Drowning. Drowning again, important question. Very commonly asked Viva question. And also in INICET, NEET PG. Define drowning. Types of drowning. Cause of death. Postmortem finding and medico-legal importance. And medico-legal importance. You need to write about the definition. Then typical drowning, atypical drowning. Then cause of death, usually asphyxia, vasovagal inhibition, postmortem finding, internal and external, and the medico-legal importance. Okay, so what you need to write in the exam. So this is what discussed in Farre book also. So and these notes you can take it from me after the class. So drowning is a form of asphyxia due to aspiration of fluid. So aspiration of fluid into the lungs, into the air passages, caused by submersion in water. Caused by submersion in water or other fluid. So it can be other fluid also. Like example, drowning in a drainage tank. So yes. So now increase the types of drowning. So types of drowning basically typical and atypical. So typical freshwater and seawater. Atypical dry drowning, immersion syndrome and secondary drowning. So can anyone tell me what is the cause of death in freshwater drowning? Freshwater. Sarabjit. Freshwater, what is the cause of death? Seawater, what is the cause of death? Dry drowning. So this is very important. In freshwater, remember, there will be hyperkalemia. Hyperkalemia can lead to cardiac arrhythmia. Seawater, myocardial anoxia. Dry drowning because of laryngospasm. Immersion syndrome is because of vasovagal inhibition. So secondary drowning because of the complications, because of pneumonitis, encephalitis and all. So all these are basically types. Good. So good answer, Priyanka. That's great. So this is what you need to write in the exam. Freshwater. So hypotonic, there will be hemodilution. When there is a hemodilution, increase volume of blood. So normal blood volume around 5 to 6 liter. It becomes 10 liter, 12 liter. So there will be overload. When there is a overload, cardiac arrhythmia will occur. Ventricular fibrillation. At the same time, so there will be dilution of plasma, rupture of RBC, release of potassium, hyperkalemia. So when there is a hyperkalemia, so there will be heart failure and death. So death occurs within 5 to 6 minutes. 5 to 6 minutes. So Arlene, Nafisa, very good. So this is what you need to write in the exam, especially a 3-mark question, freshwater drowning, a flow chart. So just go through this, or you can take the screenshot of this and you can save and you can revise for time being. Then comes is seawater. Seawater, hypertonic solution. As you know, there is a more NaCl. So that leads to hemoconcentration. So it become 3 to 4 liters. Normal blood volume 5 to 6 become 3 to 4 liter. So that leads to hypovolemia. When there is a hypovolemia, what happens? Circulatory collapse. And there can be pulmonary edema. So because of the entry of more and more plasma into the lungs, there can be a pulmonary edema. So pulmonary edema can be seen in fresh water also. Then that leads to heart failure, asystole, and death. So death occurs in 10 to 12 minutes. So in general, fresh water death occurs immediately than the sea water. Good. So this is about sea water. Then dry drowning, I said already. So dry drowning because of laryngospasm, laryngeal spasm. So fall in water, water enters the lungs or enters the trachea. So foreign body sensation. So the foreign body can lead to laryngeal spasm. So adduction, abduction, right? So that leads to asphyxia and death. So all of you write in the chat box. So dry is equal to laryngeal spasm. Yes, good. That's great. Then comes is your immersion syndrome. See, whenever word immersion syndrome, cold water drowning. So cold water can stimulate vagus nerve. Vagus nerve can cause vasovagal inhibition and death. So cause of death is VVI. So all of you write in the chat box. Hydrocution is equal to immersion syndrome. That is equal to VVI. So VVI. So what we can see here. So the cold water can stimulate vagus nerve. VVI. So write this in chat box. So keep writing. Hemant, Nafisa, Dhananjay. That's great. Then this is one table. This I will provide you. You can just go through after the class. Difference between fresh water and sea water. So there are around 10-12 points are there. So if they ask you the main question, 5 marks question, you can write this. So basically size, weight, color, consistency, effusion, then what is the finding in cross section, what about the surfactant and all that is given. You can just go through this after the class. It's of more theory, less practical basically. That's okay. Then postmortem finding. Postmortem finding. Good. So let's see postmortem finding, autopsy finding as usual like in case of hanging. So external and internal finding. So one by one. Now look at this. So this man died due to drowning, especially freshwater drowning. So on examination, what you can see here, there is a finding here. There is a finding and other findings as well. Can anyone tell me what are the findings over the face? Drowning. So face, what is the finding? External finding. So 4 important findings. So one is the froth. What type of froth? Fine leathery froth. Fine leathery froth. The froth increases on chest compression. Is it specific? No, non-specific. It can be seen in various conditions. So can anyone tell me what are the other conditions of froth? 3 marks question. Froth is seen in Viva question. My favorite Viva question. Froth is seen in dash conditions of forensic medicine. So one is drowning, you said, I said already. Snake bite, very good. Snake bite. OP poison. Opium poison. So it can be seen in pulmonary edema, right? So good. All these are causes. Good answer. So it's a fine leathery froth, increase on chest compression. Why? What is there in the froth? So the froth is because of the mucus and surfactant. Okay, froth is because of mucus and surfactant. And remember, the froth is commonly seen in conscious drowning. Conscious drowning. So when person is conscious, there can be breathing efforts. When breathing efforts are there, there can be more and more froth production, mucus production. That leads to froth. Basically, we call it a frothy lung. Frothy lung in conscious drowning. So all these are very important points. So the point about froth. What are the common sites of froth? Nostril and the mouth. Okay. Yes. Then comes is your, look at this, cyanosis. Cyanosis. There can be petechial hemorrhages. Petechial hemorrhages. Then also sometime you will get sand particles. Sand particles. And in some condition you will get something like this. Something like this, postmortem artifact. What are these? What are these basically? Can anyone tell me? Priyanka? What is the finding there in case of drowning? Postmortem artifact. What is that? Tardive spot, ठीक है? वो तो हो गया, petechial hemorrhage same ही है. हाँ, very good, Lion. Lion is telling, sir, there can be something known as aquatic animal bite. Aquatic animal bite. We call it as postmortem artifact. Artifact is an unreal thing. All these are basically findings over the face. Okay, so we covered everything. That's okay. That's fine. Then look at this now, this finding. Look at the hand. The hand is sodden and bleached appearance. You can see the bleached appearance and it looks very heavy, watery. What is this known as? Watery hands. Sodden hands. So this is known as washerwoman hand. Washerwoman hand. And all of you remember, this is non-specific. Non-specific. This is because of water imbibition. So when water enters into the epidermis that separates from the dermis, so that leads to this washerwoman hand. So now here entire hand is involved. When you see entire hand is involved, my question is, what is time since death? What is time since death? See, when fingers involved, time since death is different. When entire hand is involved, time since death is different. Again, when there is a glowing, deglowing of the skin, that difference. Okay. Yes, 24 hours. Very good, Somirip Sarkar. So 24 hours. 24 hours. Fingers, 3 to 4 hours. Deglowing of skin, 3 to 4 days. Or 2 to 3 days. Non-specific. Washerwoman hand. Good. Then look at this very important finding. In some cases, you will see like this. Okay. A case of drowning like this. Okay. What is this finding known as? With aquatic plant in the hand. Sometimes mud in the hand. Aquatic plant, mud, plants, sometimes aquatic animals, whatever that is. Depends on the crime scene. What is this known as? So this is very, very important finding. So that is basically cataleptic rigidity. Also known as cadaveric spasm. And it is a feature of antemortem drowning. Okay. If they ask you in Viva, surest sign of antemortem drowning, that is cadaveric spasm. No doubt in that. Surest sign of antemortem hanging, dribbling of saliva. Surest sign of burn injury, tooth particles in the lungs, trachea, or the bronchioles. Very important MCQs. Good. That's great. Next, look at this now. This finding in case of drowning. What you can see here, okay, the hair, you can see that straightened hair, contraction of superficial muscles of the skin, है ना? We call it as erector muscle, right? Superficial muscle. So what is this known as? So this is known as cutis and serina. Cutis and serina, also known as goose skin. Goose skin. Again, non-specific. It can be seen in hypothermia as well. Hypothermia as well. That's great. Dhananjaya and all. That's great. All are answering. That's great. Then internal finding. So what happens in case of drowning, especially conscious drowning? So there can be breathing efforts. When there are breathing efforts are there can be more and more froth. There can be more and more damage to the alveoli. So this is known as emphysema aquosum. So what we can see here, so ballooning of the lungs, ballooned lungs, alveoli are dilated. Alveoli are dilated. There is a rupture of alveoli. There is a froth. Froth is there, and you can see the hemorrhages there. Hemorrhages there. And also what we can see here, rib markings. You can make out the rib markings here. So all is the rib markings. So rib markings are there. Rib markings. So when all these are there, so this is known as emphysema aquosum. Emphysema aquosum. 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 When emphysema aquosum is there, that means conscious drowning. So write this in chat box. So all of you write. Emphysema aquosum is equal to conscious drowning. Very important concept. When person is conscious, there will be breathing efforts. So breathing efforts, breathing efforts, breathing efforts. So there can be emphysema seen, emphysema, alveoli damage and all. So this is very important finding. Good. That's great, Aryan. Emphysema, good. Aryan, all answering. That's really nice. Really nice. That's up to you. Okay. Chalo. Then in some condition you will see hemorrhages. So all these are subpleural hemorrhages known as Paltoff hemorrhages. Paltoff hemorrhages. So this is the sixth important finding. Then let's see some more findings. So two more findings are there. So especially third year prof students. So there are some signs given in Anil Agrawal textbook. If you write these signs, examiner will be very happy. He'll be very, very happy. Signs in drowning, especially from Bangalore Medical College and other colleges. Please write this. This is very important. Third sign. Third sign is rupture of mucosa of stomach. So micro rupture of stomach mucosa. So sad sign. For example, this is stomach. So what happens in drowning? So there can be rupture like this. So this rupture is known as Sehat sign. So all of you write in the chat box, Sehat is equal to stomach sign. Sehat, stomach sign. Write this. Very important. This is what will give you a distinction in the exam. Sehat sign. Then Widler three-ring sign. What is Widler three-ring sign? Again, that is stomach finding. So what happens in stomach in case of drowning? When you preserve the stomach contents, so there will be three layers like this. So what you can see here, so this is gastric contents, the gastric content, the stomach content. So at the bottom, what you can see here, solid. Then you will see the liquid. And above that, you will see froth. So this is known as Widler three-ring sign. Widler three-ring sign. That means froth, fluid, and solid. Solid means that can be idli vada, whatever that is stomach content, roti, chapati, whatever that is. Fluid basically water. Froth is because of the surfactant and mucus. So this is known as Widler three ring sign, commonly asked. Then Sabinski spleen sign. In most of the cases of drowning, because of asphyxia, so there can be small anemic spleen. Small anemic spleen. So that is known as Sabinski's spleen sign, Widler three ring sign, then SAD sign. So Arlen, Sutapa, so getting my point. So bit difficult one. So I think you understood. Yes, all of you say, my dear students, how is the Josh? The Josh should be very high in forensic class. Okay. So your teacher is having lot of energy, and you also must show a lot of energy, and you should keep me awake in the class. Yes, guys. Hi, Arya, Sinch. Hi. Good, great. That's great. Okay. Then the last important finding, that is basically, now look at this now. Now just tell me what is this sign. This is stomach content. So this is froth. This is liquid. And this is solid. So ये देख के बताओ ये क्या है? What is the finding here? Yes. So this is very good, Samirip Sarkar. Samirip, excellent answer. So Widler three ring sign. Okay, that's fine. Then one more neat PG question. Okay. So postmortem staining. So what happens in drowning? So the postmortem staining normally seen the front of the body like this, front of the body. Okay. See, air in the body. When there is a more and more water that enters into the body, so it attains this position after 1 hour, 2 hours, after 3 or 4 hours. So this is the final position. So this is the final position of the dead body in case of drowning. So again, all of you try to understand the concept. So when there is a drowning, so the more and more water enter into the lung and also into the stomach, everything it will go. So what happens? Specific gravity, so that increases basically. So this is the final position, like this, final position. So my question is, what is the site of postmortem hypostasis in case of drowning? Come on, guys. Come on, try. Try. Where it is seen? Very good. So lion is telling sir face में होगा और chest में होगा और hand and feet. Very good. Face down, buttock up. Comedic, very good. So this is basically face down and buttock up. Buttock up. So this is how. So I do teach in live classes. So good, Samirip Sarkar, thank you. So basically seen over the anterior part of the chest, anterior part of the face, lower part of the lower limb and lower part of the upper limb. So very good. So all of you just write in the chat box, face down, buttock up. So face down, buttock up. Face down, buttock up. Write this in chat box. Priyanka. Come on, try. So that's really nice. Then very important finding, that is in case of diatoms. So okay, diatom is missing here. So diatoms is one more important finding. So diatoms are unicellular algae. They have extracellular coat of silica ion. So when they are seen in the bone marrow, brain and all, it is antemortem drowning. So diatoms are seen in antemortem drowning. Antemortem drowning. So especially in brain and bone marrow. So diatoms Normal site of diaphragm aspiration is femur and sternum. The technique that is used is acid digestion technique. Acid digestion technique. So 4 points. If you write this, more than sufficient. Then the manner. So what is the manner of drowning? Manner of drowning. 1, 2, 3. Yes. Come on, guys. So Dhananjay, what is the manner? What is the commonest manner of drowning? Right. So one is suicide, especially dowry death. I know dowry death. That is 80 BNS. So method of suicide, dowry death, punishable under 80 BNS. Second, homicide. So punishable under 103 BNS. Homicide. Or sometime it can be accidental. Okay. Accidental death, especially in non-swimmers or in children's or in case of head injury. Okay. Or due to snake bite. So snake bite in the pond. So that can lead to death. So accidental death. So all these are basically the manner. So all of you write in the chat box. So dowry death is equal to 80 BNS. Dowry death is equal to 80 BNS. Keep writing. So this completes our drowning. So there are 8 findings. MLC, okay, medical importance we discussed. Yes, everything that is fine. Okay, if you write this, that's more than sufficient. We covered everything. Everything in 20-30 minutes. That's great. So dowry is equal to 80 BNS. This can be MCQ. That's great. Aishwarya Baliga. That's great. Chalo. Then some more questions I'm going to give you. You can just go through after the class. Difference between ligature strangulation, hanging. 5 marks question. Ligature strangulation and hanging. So remember one important finding. Ligature strangulation, horizontal ligature mark. Suicide, oblique ligature mark. Dribbling of saliva in case of hanging, not in case of strangulation. So very important. You can just go through after the class. Important, most expected question. Then types of suffocation or types of suffocation, like example, traumatic asphyxia, smothering, working, cafe coronary syndrome, choking. So you need to write this, basically 3 marks question. 3 marks question. Important. Smothering can be a 10 mark question also. Okay, smothering. Then cafe coronary syndrome, my favorite topic. Cafe coronary syndrome. So death of a person. So in a bar and restaurant, while having alcohol and while having meat, so while having KFC items or while having banana, we call it as banana syndrome also. Can anyone tell me what is the cause of death in cafe coronary syndrome? What is COD? COD, cause of death in cafe coronary syndrome. Like example C. I'm very happy today. I'm having alcohol. Okay, like this alcohol. Then I'm having some meat like this. Okay, some good food. I'm enjoying my life. Suddenly some meat particle will go and occlude my larynx. So there can be choking and death. Or sometimes this banana and this alcohol can be dangerous, which can stimulate your vagus nerve and death. So cafe coronary syndrome looks like a heart attack, mimics like a heart attack, but cause of death is, the cause of death is basically, that is choking bhi ho sakta hai. So basically vasovagal inhibition. Soumyadeep, very good. So vasovagal inhibition. Soumyadeep, excellent answer. So banana syndrome, vagal inhibition. That's great. That's great, Priyanka. That's okay. Then throttling, very important, 5 marks. Burking, 5 marks question, very famous method. William Hare and William Burke, they used to supply dead bodies to a medical college, very important. Banks-Dola, already we discussed, 3 marks. So garroting also 3 marks question. So all these are important question from asphyxial death. So I discussed in detail about hanging and drowning. So most expected topics. Rest all are you can just go through after the class. Okay. So yeah, soil there. Yeah. Now we have most important session now, that is spotters in toxicology. Only 10 minutes. 10 minutes. So all of you, okay. Spotters in toxicology. So ready? Ready guys? Ready? So ready for the final interactive session? Come on guys, say yes or no. Yes, ready. Dr. Sinch is ready. 10 questions are there. So there are 10 questions. Yes, Aryan ready. Nafisa ready. Sinch ready. Lion ready. Okay. Now, so for each spotter, you need to identify. The first thing you need to identify. First identify. First write the spotter name. 1, 2, 3, 4 like that. Okay. Then you need to write about MLI. Medico-legal importance. Medico-legal importance. You take your own time. So around 30 second to 60 second time. Okay. And let's see. All of you understood? Identify and MLI. Medico-legal importance. Yes, ready? Hemant? Chalo, all ready. So the first spotter. Don't answer in group, just answer with everything that is. So this is the first spotter in forensic. Hi. Take your own time and answer. Then I'll provide you the answer by myself. Try. So your time now. So all of you, this has pink flowers. This is organic irritant. Try. Okay. Danish. Come on guys. This organic irritant, which consists of calatoxin, calotropin, right? So identify. Calotropin is okay, but it is a pink flower. Pink flower is there, no? Pink flower. So this is basically Calotropis gigantea. The active principle is gigantin. The MLI is, all of you concentrate, it is used in abortion. It is used in artificial bruise. Artificial bruise. It is also used as infanticide. It can be arrow poison. Arrow poison. Then one more is there. It is also cattle poison. So cattle poison. So how many of you answered? Okay. Arya, Toprani, Danish, Aishwarya, Ikhe, Dhananjay. Okay, I think Ashit. All the 5 points, okay? All the 5 points you need to answer. Abortion, artificial bruise, infanticide, arrow poison, cattle poison. Calotropis gigantea. So this is 3 marks question as well. Yes, good. Hello, all great. So Hemant, Priyanka, Aishwarya, Nafisullah. So we will analyze. Thank you. So that completes your question number 1. So what you need to write in exam 3 marks question? There are 2 types of calotropis. Calotropis gigantea, that is having white or purple flowers, not scented. So Calotropis procera. So again it has white and pink flower, and anything Calotropis is a correct answer, non-scented. So active principle is calotropin, calotoxin, gigantin, calactin. So then active principle calotropin, calotoxin, calactin, gigantin, usherin. I think nobody has answered usherin. Usherin is also active principle. Usherin. Okay, that's okay. Then now time starts now. Time starts now. Look at this. Again, medico-legal importance. So you take your time, write the question number first, question number, think for some time, then you answer. No need, no worry. So 30 seconds to 60-second time is there. So this is somewhat a black snake, is having white transverse band is there, no triangular head, very cunning snake, like a kattappa, like a bahubali kattappa, very cunning. It has a tendency to bite people in their sleep. It causes okay, right, some 3-4 points. Okay, so some are telling sir common crate, Ashit telling is common crate. Okay, right, keep answering guys, keep answering. Yes. So question number 2 and MLI and MLI. Keep answering. Yes, Aryan. Okay, good answer, Aryan. Aryan is telling sir common crate hai. So common crate. Okay, good. Common crate. Yes, it is common crate only. It's common crate. That is correct. So the scientific name is Bungarus ceruleus. It is neurotoxic. Yes, MLI, it leads to death by neurotoxicity. That's great. The point number 2 is usually accidental. The fatal dosage of venom is 3 to 6 milligram. So what is the cause of death? Respiratory paralysis. So point number 3. And one more point, I think nobody has answered. Okay, good. Hemant answered correctly. Sir, Hemant is telling, sir, it is painless. It resembles like stroke. That's great. And one more point is there. It is presynaptic. So 5 points. Okay. So common crate, neurotoxic death, 3 to 6 milligram, respiratory paralysis, painless death, presynaptic, produces bungaro toxin. It is like a kattappa. It has a tendency to bite people in their sleep. So good. Occult bite. Yes, Aryan is telling occult. Okay, good. So Arlin, very good. So Arlin, I think he answered better than others. Arlin. So that's great. That's great answer. Chalo. Next. Next, third one. Third. Now look at this straight answer. Again, same. Question number 3. Identify and MLI. MLI are some other features. Are treatment. Can tell about treatment also. Okay. What is this? This is what? Kidney shaped. Kidney shaped. Brown color. Kidney shape, brown color. The fatal dosage is 100 seeds. Okay. No. Many answers. Strychnine. Strychnine beta, that is circular. So this is kidney shape, hai na? So this is basically known as datura seed. So this is datura. Datura seed. Fatal dosage 100 seeds. Active principle atropine, hyoscine, hyoscyamine. So it leads to delirium. So point number 1, it leads to delirium. So this can be utilized in robbery or sometimes sexual assault or kidnapping. Point number 1. Point number 2, it is also used as a road poison. Road poison. Road poison. Okay. Good. So treatment you can write physostigmine. Physostigmine. And remember 9D manifestations. 9D manifestations. Very commonly asked. And one more question for you. In case of datura poisoning, you will get some delusion like this. What is this delusion known as? Like pulling the imaginary threads from the fingers. Like this. You'll be doing like this. Like this, like this. What is this known as? Come on, Aishwarya. Muttering. So muttering delirium, that's okay. Muttering delirium. That's fine. Muttering delirium. ये क्या है? ये क्या है? चलो. Arlene, very good. So this is basically carpologia. 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 Good. Carpologia. That's great. So that completes your 3. Now 4. So this is okay. Now this is already discussed. No, this is datura only. No need to answer. So this is apple. My favorite apple. Okay. Apple, keep the doctor away. But this is datura, keep the doctor nearby. Physostigmine. Remember, thorn apple. Thorn apple is bad. So good apple, bad apple. Good apple, bad apple. Try to remember that. Okay, so that's great. Okay, now fourth question. Again, same question. Identify and MLI. Look at this now. Look at this. Good. Try 5 points, guys. 5 points. So what we can see here, it is in clusters. So this is basically Ricinus communis. The common name is castor plant, Arandi plant. So what is the active principle? Resin, organic irritant. So it leads to hemorrhages and death. So what is the medico-legal importance? So this is used in case of bioterrorism. Bioterrorism. In case of murder. Sometime suicide. So when it is taken through the needle, especially the juice of the resin. So this is basically Ricinus communis. So seeds are shiny. The fatal dosage is 10 seeds. 10 seeds. Good. So yes, SJ, very good. So oil is not harmful. Oil is not harmful. So when it is taken through the intravenous intramuscular route, yes. So one very famous case. So can anyone tell me what is the one very famous case of murder that is related to castor plant, Ricinus communis? Ricinus communis. Come on, guys. Come on. Dhananjay. Very famous case of murder caused by Ricinus communis. हाँ, UK था. Okay, Ashutosh, you were right. It was in UK. अच्छा, it was in Gautam Bishwas. Okay, that's fine. हाँ, क्या था बताओ? Ashirat V Bharadwaj. It was in UK. ठीक है. It was in UK or European country only. Okay. Yes, come on. Yes, Sohail Dar, it's free series on YouTube. Tomorrow, day after tomorrow, free series. You can interact. Okay. So VV Pillai has it. Okay, chalo. Scotland. No, my question is, what is the name given to that? I'm giving you clue. Rainy season. In rainy season, we use something in the rainy season. What is that? What is that murder case known as? So, nobody answered. Umbrella murder case. So all of you write in the chat box. Umbrella case. So, umbrella case in case of calotropis. Sorry, not calotropis. Resin. Write this in chat box. Umbrella case is equal to resin. After the class, just type in the Google, you'll get the answer. Umbrella case of murder. Okay. Umbrella tip was used as a poison. That's great. That's great. Okay. Hello. That is okay. Then we have fifth one. So the fifth one. Fifth one. Look at this. What is this? What is this? This comes under CNS poison. You can see here. Green capsule. Green capsule. Somadev Sarkar. Identify. First point, identify. The second point, active principle, AP. Third point, MLI. Bad man. MLI. Yes, good. Try answer, keep answering. So this is basically, take your time. So last 10 minutes, guys, we'll complete the class. So we have 5 more questions are there. After that, we'll continue tomorrow. Acha, theek hai. I need medico-legal importance, guys. So okay, it's used as analgesic, contracted people, respiratory paralysis. That's okay. That's great. Nafisullah, sedative. That's great. Respiratory. Okay, respiratory paralysis. Medico-legal importance. So medico-legal importance. Identify. Your time is over. Papaver somniferum. Papaver somniferum. I think Aishwarya answered. Aishwarya Baligar. Excellent. So it is known as poppy plant. Papaver somniferum. So which produces morphine, right? Morphine. So when it consists of 10% morphine, known as standard opium. Standard opium. So active principle, morphine. So and other codeine and other also. Okay, morphine basically again classified into natural, semi-synthetic, synthetic and all in opium. So morphine, if you write, that is fine. Brown sugar, you diacetyl morphine. Then MLI basically it leads to drug dependence. So it leads to physical and psychological dependence. It is also used as an infanticide agent. Infanticide agent. Okay. Drug dependence, infanticide. Then body packer syndrome. Body packer syndrome. So cause of death is respiratory paralysis. There can be pinpoint pupil. There can be euphoria, pinpoint pupil and other features. So these three you need to write in the exam. And it is punishable under NDPS Act. NDPS Act. So cultivation, storage, transport, consumption is punishable under NDPS Act. NDPS Act. So 4 important points. Okay, now sixth question. Identify and clinical feature. Clinical feature. Okay, that's it. Identify and clinical features. Good. Try. So what you can see here, circular seeds are there. Looks like a banana chips with the central depression with the hairs. So central depression, hairs, looks like a small banana chips. Looks like a dog button. Dog button. Identify and clinical features. 3 clinical features. Yes, good. Many answered correctly now. So Nux swamica. It is Nux swamica. Clinical feature. Rhizus sardonicus. Opisthotonus. Pleurostotonus. Amprosthotonus. It resembles like tetanus. Okay, fatal dosage 1 seed. 1 seed. So what are active principle? So active principle mnemonic is BSNL. BSNL. So B for brucin. S for strychnine. Okay. L for loganin. So it's a spinal poison. So it inhibits the glycine. So it acts on the spinal cord. No CNS features. No loss of consciousness. So this is basically spinal poison. Consists of BSNL. All of you right? Nux swamica is equal to BSNL. Nux is equal to BSNL. So write this in chat box. Keep writing. So Priyanka, Nafisa, Dr. Sinch, Sutapa, Samantha, great, you are very attentive. So this completes your sixth one. So all of it just try to remember. Okay, this is just to tell you dog button that is used to kill street dogs, that is strychnine, spinal poison, है ना? Spinal poison. Not exactly. Some overlapping is there between pharmacology and forensic. Raj. Okay. Street dogs. Next we have seventh one. Seventh one, identify and clinical features. Clinical features of chronic poisoning. Identify and clinical features. Okay. White color powder, colorless, tasteless, odorless, can be mixed with any food and drink. It resembles like cholera. Ideal homicidal. King of all poison. King of all poison. What is this? What are clinical features in chronic and treatment? And treatment. 3 points. Try. So come on guys, you try. So 30 seconds is the time. So in meanwhile, I'll do some play, okay? You're answering well. I'm very happy. Very happy today. Very happy. Come on guys, come on, time up. Time up. Yes, good answer. I think Aishwarya answered and Priyanka. There is a tough competition between Aishwarya and Priyanka. So both are answering very well. So this is basically arsenic trioxide. Arsenic trioxide. So it is not oxide, arsenic trioxide, As2O3. Clinical feature, cholera-like feature, raindrop pigmentation, RDP, raindrop pigmentation, measle line, erythromelanosis. Okay, there can be cancer of bladder, skin and all. Rice watery stool. So basically treatment is, yes, many answered. Ball. British anti-levisite. British anti-levisite. That is a drug of choice in case of arsenic poison. So this is the answer. That's great. Then we have very important compound, poisonous compound, heavy metal poison. Okay, heavy metal poison, we call it as kumkum, sindoor, है ना? So all of you guys, एक चुटकी सिंदूर की कीमत तुम क्या जानो रमेश बाबू, तुम क्या जानो रमेश बाबू. This is one very famous film of our time, not the Gen Z, our time. Ramesh Babu, है ना? एक चुटकी सिंदूर की कीमत तुम क्या जानो रमेश बाबू. चलो बाइस, ठीक है? Try. Okay. Good answer. So this is basically, I'm talking about mercury sulfide. Okay. Again, clinical features same. What are clinical features? Try all of you guys. Mercury clinical features. Just give me the name of mercury poisoning. अच्छा लेड टेट्रोक्साइड वो सब ठीक है, वो लेड टेट्रोक्साइड है. सो मर्क्यूरिया लेंटिस, mercurialism, good. So basically it leads to Pink's disease. Pink disease, Mercuria lentis, Mercuria lentis. There can be tremors. So okay. So this is basically the question. Acrodynia. Yes, one more point is acrodynia. Acrodynia. So you must know fatal dosage, fatal period and all. This is mercury sulfide. Just remember the movie Om Shanti Om, old movie. Yes guys, Minimata disease. So yes, good. Calomel disease, that is also correct. So this can be lead compound also. Lead compound also, you are also right. So my mind basically mercury sulfide so was the answer basically. It can be other compound as well. So and remember medico-legal importance. So this is used to prepare artificial blood-like fluid. So like in crime scene investigation for demonstration and all, we use this. Okay, liquid of mercury sulfide as a blood stain. Okay, that's okay. So all of you guys, have you seen this movie? Is it good movie or okay movie? You just tell me guys. Was it good? Have you seen this movie? Ramesh Babu, Ek Chutki Sindoor. Come on guys, come on, try some fun is needed in between. Priyanka. Dr. Sinch is telling sir good movie. Okay. Now I'll show you some acting now. You need to identify what delusion I'm having. Okay. So what delusion I'm having. So all of you, one more question for you. So something related to Deepika Padukone and me. Something really personal. So this is a delusion I'm having. Imagine I'm having some delusional disease. So okay, you just identify. Sometime I do think that. Sometime I do think that Deepika Padukone is in deep love with me. She's in deep love with me. She is married. I am also married. But I do think constantly that she is in deep love with me. Okay. So what is this delusion known as? Yes, come on guys. Come on guys, I'm waiting. Waiting. So it's very common in females, can be seen in males also. The person thinks that someone from higher standard, maybe boss, is in love with him or her. Okay. Okay, good. Ashutosh is telling, sir, this is erotomania. Erotomania, very good. Erotomania. Okay, erotomania. Good answer. Erotomania. So all of you write in the chat box, erotomania. Erotomania is equal to female. Write this in chat box. Common in females. Erotomania is equal to female. MCQ, commonly asked Viva question. Okay. Erotomania is equal to female. Good. Okay, now one more delusion I'm having now. So one more forensic psychiatric question. You need to identify. Okay. You need to identify the next delusion. See, I'm in the deep love with this Deepika Padukone. So depression. So now I am totally depressed now. Now I'm depressed, Guru. So I just think that world is going to end. The world is there, no, that is going to end. Everybody is going to die. I'm already dead. My liver is already dead. My brain is already dead. So what type of delusion is this? I'm suffering from psychotic depression. Very severe depression. I'm having this type of depression and having this type of delusion. ये क्या हो सकता है? Yes, come on guys. Aishwarya Beligor. Good. Nihilistic delusion. Excellent answer. Nihilistic delusion. Nihilistic delusion. So all of you write in the chat box, nihilistic is equal to depression. So write this in chat box. Nihilistic is equal to depression. Depression of negativity. The world is going to end. I am going to die. You are already dead. Why are you reading for entrance exam? Don't read. So something like that. Total negative. Negative about the past, negative about the future, negative about the present, the backstrad. We call it as depression. Okay. Good answer, Dr. Sinch and Priyanka. That's really nice. Chalo. This is okay. Then the question is, oh, this is one very interesting question, guys. Direct question. One of my favorite movie, Devdas. Okay, Devdas. Favorite drink, you know. Test for alcohol concentration in the body. How to test alcohol in the body? Come on, guys. 8th question, 9th question. 2 more question. Alcohol. Alcohol is seen as depressant. So legal limit of alcohol is 30 milligram percentage. What are the tests for alcohol concentration? Yes, 3 tests are there. The mnemonic is Amitabh, KBC great. Amitabh KBC great. So A for alcohol dehydrogenase, alcohol level. K for Cavet test. So K for Kozalka test. Yes, Kozalka. B for breath analyzer. C for Cavet test. G for gas chromatography. Gas chromatography. So mnemonic is Amitabh KBC great. So Dhananjay, yes, good answer. Okay, that's great. So the last question, and the last question of the day. So this is the last question. Try this, guys. So all these are poisonous seeds. So poisonous seeds. So identify and clinical features. No, they are not chili seeds. No, they are not chili seeds. All of you guys, they are not chili seeds. Look at the seeds. Something is there yellow. Yellow is there. No, it is not chili seeds. So chili seeds, they do not look like this. Okay, they're basically some other seeds which usually affects the bones and the nerves. So bones and nerves. What is that? No, not chili. Oleander, no, it's not oleander. So which causes neurotoxicity It affects the bones. Sometimes it can affect the skin also. This is some grain item basically. Grain. Croton tiglium वो भी नहीं है. No. ठीक है. What are these seeds? No, Ashutosh, not strychnine. No, not capsicum annum. It is also related to PSM. Drug adulteration topic. Abrus, no. Abrus is red and black. Nafisa. Try. So nobody has answered. So this is basically okay. Consists of BOA. Bo. This is Kesri dal. The active principle is beta-oxalyl aminoalanine, affects the nerve, which causes neurolithiasis. So it causes neurolithiasis. Osteolithiasis, or it can affect the blood vessel as well. Okay, so this is lithiasis. So lithiasis, Kesri dal. Good. This is the answer I wanted. Okay, good. So this completes your session. So after the class, just go through this slide, a very important slide in forensic medicine, as well as PSM, as well as INA-CET. Neurolithiasis caused by BOLL, caused by Kesri dal. It is a crippling disease, affects the nerves. Epidemic dropsy. The active principle is sanguinarine. The plant name is Argemona mexicana. Very important. Then endemic ascites, so which causes ascites and jaundice because it is a hepatotoxic. So pyrazolidine. So it is basically Zunzunia plant, pyrazolidine. So all is a 3 marks question. So 3 marks. 3 marks and 3 marks. So very, very important. Yes, so this completes your session. Yes, guys. So just to summarize, so we started with the distribution of topics in forensic medicine, then hanging, so then drowning. So both are important main questions. Then comes is autoerotic hanging, important 5 marks question. Then strangulation, so types of drowning, so we discuss in detail. Then external finding and internal findings, medico-legal importance. In forensic, important is the medico-legal importance. Then we started spotters. Basically 10 spotters are completed. So very commonly asked in your viva and in your practical exam, as well as your entrance exam also. 10 important interactive MCQ session. So this is more than sufficient for today. So tomorrow we will have one more session the same way. The beginning 1 or 2 important long essays. Later again the spotters in forensic medicine. So there are 8 classes are there. So this is the first class. We have 7 more classes. So So any doubt you can ask me. If you have any doubt, you can ask me. Yes, that is scheduled day after tomorrow. So thank you all, guys. So thank you all. So our brownie is waiting for you for tomorrow's class. Okay, with some more important clinical scenarios. Thank you all. Say thank you to our brownie. So brownie is very tired today, around 2 hours. So we'll come up with some more interesting session tomorrow. So till then, bye bye.